Central nervous system, paper 3 master pass, ठीक है. Question number 1, toothache, patient toothache, OPG was mixed lytic and sclerotic mass centered on the apex of the right lower canine, most likely diagnosed cementoma. Okay, the patient usually has caries, dental caries. Okay, now there's mixed lytic and sclerotic mass centered on the apex of the canine, here upper tooth, but apex of the canine, diagnosed cementoma. Mixed lytic and sclerotic mass on the apex of the lower canine, diagnosed cementoma. The apex of the canine, cementoma. This cementoma is cementoblastoma with this cementoblastoma, the other cementoblastoma, and this is odontoma. This cementoblastoma, this is a mixture of all the components, fat, tooth, etc. This cementoma, and these are odontoma. Okay, odontoma is the base. Cementoma, odontoma, and cementoblastoma. Cementoma occurs apex of the tooth. Odontoma occurs the base of the tooth. And cementoblastoma has all the components of the tooth, fatty components, etc. Next, question number 2: a multilocular cystic lesion with expansile scaval margin is seen at lying adjacent to the right lower first molar on OPG. The cyst has thin septated margin and root of the molar is absorbed. Amyloblastoma. Okay, when is expansile is septated multilocular cyst seen adjacent to right lower first molar, and usually the unerupted tooth there is with it, and the cyst has root of the molar absorbed, diagnosed amyloblastoma. Dendritic cyst, amyloblastoma. Amyloblastoma extends to soft tissue. धुंधला सा नजर आ रहा है.
जी सर.
ठीक. ये पहले सीमेंटोमा है, ठीक है, एपेक्स ऑफ टूथ में होता है. फिर ये दोनों जो है और सीमेंटोब्लास्टोमा है. It occurs at the root of the tooth and the cementoblastoma. Correct? This is then odontoma. This last one, odontoma. It consists of all types of tissues in the teeth, fatty tissue, tooth component, etc. Yeah. Let's go. Okay.
What is PNG?
What is?
What is PNG last?
This one?
Yes, sir.
Odontoma.
Last one.
This is odontoma. These two are cementoblastoma. This is cementoma. Correct? Cementoblastoma occurs at the root of the tooth. It consists of tooth formation tissues, and odontoma contains all tissues of tooth.
Okay.
This is amyloblastoma. This is amyloblastoma, and these are animal bone cysts. But for now, we'll just look at amyloblastoma now. Okay, animal bone cysts, you can see aneurysm fluid level in these. This is animal bone cysts. The amyloblastoma. Now we'll deal with amyloblastoma. A multilocular cystic lesion with expansile scalloped margin is seen lying adjacent to the right first molar. Multilocular cystic lesion with expansile scalloped margin seen adjacent to the right lower first molar on OPG. Okay, it has thin septated margin and the root of the molar is absorbed. Thin septated margins. The dendritic cyst with amyloblastoma and amyloblastoma. The root of the molar is absorbed. Usually, roots of the molar are absorbed. Diagnosis: amyloblastoma. Hence, expansile lesion in the mandible, and then it absorbs the roots of the molar with thin internal separation. Diagnosis: amyloblastoma. The dendritic cyst occurs at the root of the unerupted tooth, but when this comes, we will discuss it. Again, new onset right side hemianopsia. What part of the optic pathway is most likely to be affected? Left optic tract. And in chondroplegia, optic radiation is affected. Like here, homonymus homopsia. With homonymus homopsia, optic tract is affected. Correct? Homonymus homopsia, optic tract is affected, and then chondrodysplasia, optic radiation is affected. Previous MCQ. Question number 4. What features on imaging make thyroid eye disease more likely than pseudotumor? Swelling limited to the muscle bellies of rectus muscle. Okay. Now here, this is thyroid ophthalmopathy. This is orbital pseudotumor. Now this is lymphoma rhabdomyosarcoma. Okay, look, the disease now. Thyroid ophthalmopathy is usually bilateral involvement, bilateral exophthalmos, and both muscle bellies are involved on both sides. Uh, and uh, and that is that it does not involve the tendrils intersection. Only muscle bellies involved. In pseudotumor, usually only one muscle outside eye is involved, and it includes diffuse involvement of the tendon and the muscle belly. Similar on ultrasound also, this third ophthalmopathy does not involve the tendon, only involves the muscle belly, and this pseudotumor involves the whole muscle thickness. What feature make imaging of third eye disease more likely than pseudotumor? Swelling limited to muscle belly recti muscle. Question number 5. Hypothyroid woman has proptosis and lid lag, which orbital muscle most likely affected? Inferior rectus. I is that orbital lid lag? Okay. The mnemonic is I am slow. So in PF disease, first is affected inferior rectus, then medial rectus, then superior oblique, then lateral rectus, superior rectus, then lateral rectus, then oblique muscles involved. So here first is inferior rectus, I am slow, so inferior rectus is most likely commonly affected. This is according to another MCQ, but it's not important. This just says that in this the little lag comes, so little lag uh, is caused by weakness of maybe superior rectus muscle, so opposite to that will be the answer inferior rectus, but the mnemonic is I am slow. First inferior rectus most likely be involved. You don't need to remember this. Question number 6. Non-Burkitt lymphoma. Yeah. A new onset right side proptosis, where is the most likely site of the lymphomatous deposit? Lacrimal gland outside the eye. Okay, lymphoma, orbital lymphoma. The melanoma, residual blastoma. Give this. Okay. Memorize that lymphoma, L for lymphoma. So Burkitt lymphoma spreads to the lacrimal gland. L for lacrimal gland. Lymphoma. Lymphoma spreads to the lacrimal gland. L for lymphoma. L for lacrimal gland. Non-Burkitt lymphoma spreads to the lacrimal gland. Number 7. 6-year-old man with drained liver enzymes. Amyloid T1 and incidental 0.5 cm high signal lesion in his right choroid. T1 0.5 cm high signal lesion high on T1 in the choroid. Diagnosis melanoma. Juvenile melanoma. High on T1 incidental lesion in the choroid of the eye. Diagnosis melanoma. Uveal melanoma. Retinoblastoma. Multiple calcified both eyes are involved, and there is a lesion seen in the eye having multiple calcium deposits, and there is also associated retinal detachment. Diagnosis retinoblastoma. Question number 8. Alzheimer's therapy. Which is the best again to ensure therapy will not exacerbate a Parkinsonian crisis? CAT scan. Now, in Alzheimer's therapy, remember the CAT scan is used. In Alzheimer's therapy, we use CAT scan. That period. So, Alzheimer's disease. So memorize it like that scan, like that scan. So TAT scan. Alzheimer's disease, that scan. Alzheimer's disease, that scan. Correct. Question 19. 18-month-old child with Turner syndrome. Sudden appearance of large fluctuant mass in the posterior triangle of the neck. MRI shows multilocular mass posterior to the sternocleidomastoid muscle, where the most likely diagnosis is cystic hygroma. The MRI shows large fluctuant mass in the posterior triangle of the neck and multilocular mass posterior to the sternocleidomastoid. Diagnosis cystic hygroma. Okay, multilocular mass posterior to the sternocleidomastoid. Cystic hygroma. Next question. This is actually a CT scan, but similar multi-system mass posterior to the sternocleidomastoid, so cystic hygroma. Question number next. Question 10. Submandibular pleomorphic adenoma. What are the most likely imaging characteristics? ISO intends to muscle on T1W MRI, just like thymoma and rhabdomyoma. Pleomorphic adenoma is ISO intends to muscle on T1W MRI. Look here, this image. This is parotid gland. So this is parotid gland tumor. This is pleomorphic adenoma, left side. This is carotid artery aneurysm, and this is left carotid artery dissection. Carotid artery dissection, carotid artery aneurysm, parotid gland tumor, pleomorphic adenoma. So pleomorphic adenoma is isosceles to skeletal muscle. Pleomorphic adenoma is isosceles to skeletal muscle. Submandibular pleomorphic adenoma were the most likely imaging characteristic isosceles to muscle on T1W MRI. This CT scan, but on MRI is also isosceles to muscle. Just like thymoma and rhabdomyoma. Thymoma is also isosceles to muscle, and rhabdomyoma is also isosceles to muscle. Question number 11. Painless facial asymmetry. CT scan shows expansion of the medullary cavity of the left maxillary bone with a ground glass appearance. The lesion was hypertension of both T1 and T2 images. Most likely diagnosis fibrous dysplasia. Whenever ground glass appearance comes, diagnosis fibrous dysplasia. Ground glass appearance, diagnosis fibrous dysplasia. Look here, there's a facial asymmetry, and CT scan shows expansion of the medullary cavity of left maxillary bone. Expansion of the left medullary cavity of maxillary bone with a ground glass appearance. Diagnosis fibrous dysplasia. This is Baker's disease. Baker's disease.